one of our very sick patients who arrived to our emergency room with a history of chest pain of about 40-minute duration. And she was diagnosed to have an anterior wall myocardial infarction. Initial team, after the triage, started giving emergency drugs, and in front of our eyes this patient collapsed and she had a cardiac arrest. The CPR team came into action. They started with compressions, and all the team started giving medications and other treatment. It took us nearly 15 to 20 minutes with monitor showing no response, and she was going downhill persistently. We saw the relatives outside in the hall. The look on their faces was dismal. The relatives were scared about, because she was 50-year-old and she was very healthy prior to this episode. She was not suffering from any disease, was not on any chronic medications. And then after about half an hour, after having revived a few parameters, after putting her on ventilator machine, we took her straight to the cath lab. There we found one of her main arteries to the heart completely blocked. With the help of wires and balloons, we opened those blocks, and then the ventilator support was continued, and she was shifted in the ICU. She required ventilator support for the next 3 to 4 days, and then she was shifted out to the ward, and later she walked out from her room back to regular follow-ups 3 months and 6 months later. This lady showed very good improvement in the pumping function of her heart, and she completely recovered from the damage that was done due to the cardiac arrest. So all the doctors and the whole team saved this patient, as our motto of the institution, that if one life saved, as if we have saved a mankind.